guys, HITS-Brent here again. So lately, I've been looking after my ex-husband's baby. It's my kid's baby brother. My ex-husband, he has a new partner now. They just had a baby, 1 year old now. If I'm off and they don't have anyone to look after the baby, sometimes they would ask me if I can look after him. It's not really a bother to me because I do love kids. And also, I think it's a good idea for the child to grow up and feel comfortable, no awkwardness in coming to my house because they're my kid's baby brother. I want him to grow up feeling like he's welcome here. He can come and go here as he please and he'll always be welcome. I think that's really good for my kids if we have our own relationship. That kind of reminded me of the things that I do know about looking after children. I realized how there's a lot of people out there that actually think it's so hard to look after babies or children just because they lack the information. And maybe if I can share that information, there will be a lot more people who will feel more comfortable looking after kids. Like for new parents, if they don't know what they're doing. When I got pregnant when I was 20 with my kids, I just finished my nursing course. And in Philippines, our nursing there is a 4-year course and it's like really detailed. They bombard you with a lot of information about a wide variety of things. Here in the UK, they have mental health separate from pediatric nursing is separate and then adult nursing is separate. But in the Philippines, all of that is like all together. Both of them have advantages and disadvantages. At least if you only focus on one, properly focus, because maybe you're not really gonna need all the other information if you're just gonna stick to that career anyway. But I guess the Filipino version, where we have medical surgical nursing, mental health nursing, pediatric nursing, maternal and child nursing, geriatric nursing, you cover too many things that, you know what, you don't even remember a lot of them anyway. But I guess in a sense, you do know a little bit of each speciality. I guess because we have covered maternal and child nursing and pediatric nursing, I have kind of an idea of how I meant to look after the baby, but it's different from actually looking after the baby. Because I got pregnant, my mom told me, well, might as well do masters. There was a lot of options to major in nursing. I chose to major in maternal and child nursing because I have the interest, because I just had a baby. It was the period where it was the main focus of my interest. I had learned a more in-depth knowledge about the complications of pregnancy. I have learned the different development stages, cognitive, sexual, motor, different stages of development, and a more in-depth version of that because of the masters. On top of that, I have read a book that my mom recommended to me. It's called Baby Wise. That actually really helped me look after my kids, guide me into making it easier for myself to look after the kids, because it's written by someone who has a lot of experience in raising children. Somehow, my way of looking after them has become like a combination of all of this, and some of it I don't really remember where I got it from anymore. I just remember the detail. I just remember the information itself. But I don't really remember if I got it. Did I get it from my nursing? Did I get it from my master's? Did I get it from the book that I was reading? Or did I get it from experience? I don't remember anymore. It's a combination of all of that. In this information, basically, there are 3 things that is in play and you have to remember when you're looking after a baby: the feeding time, the activity, and the sleep time. Different people will want different versions of feeding, but for me it was so much better to time the feeding. I used to even enjoy making a schedule. I get so excited about it. You don't really have to necessarily stick to the schedule like strictly. You have to use your own assessment of how the baby appears to be behaving and what has happened, all the other things that happened around that, to figure out what the baby wants, what you're meant to do now with the baby. You don't want to get the baby to get used to feeding while they're sleeping, or to get them to sleep, because then they will get used to that and they will be dependent on that. So your routine needs to go in this order: feeding, activity, and sleep. There's also other things to consider, like how much sleep does the baby need. But this is just a guide. It depends on how old your baby is. But it's going to be the same cycle until they're toddlers. Actually, even until adulthood, it's gonna be kind of the same cycle. You just get less and less sleep over time. So when the baby wakes up, you feed the baby. You remember the time that they wake up. Yeah, let's say for example, the baby wakes up at 7 and then you feed them at 7, right? And then after you feed the baby, like, it's activity time. Say for example, you're doing 4-hourly feeds. You just remember, okay, the next feed will be what time? If the baby wakes up at 7 and you fed them at 7, 11 o'clock will be the next feed. Before that will be the nap time. And it depends on how much sleep they need for you to figure out how much time you will spend for the activity before putting the baby for a nap. You can't just rely on the time. You also kind of observe the baby, how they're behaving. They would show you signs where they're sleepy. Sometimes they get really cranky or like start crying. It's because they're tired. This baby is 1-year-old. This particular baby needs 14 hours of sleep in the 24 hours. And 11 hours of that is meant to be at nighttime. The 3 hours is meant to be broken down into 2 naps. Keeping that in mind, this is how I calculate it. Okay, so naps are normally gonna be around 1.5 to 2 hours each for this age anyway. I'm gonna try to give this baby or let the baby have a 2-hour nap, or then I have to think, okay, at 11 o'clock they will be hungry. So before then, if I'm gonna let them have a sleep, a 2-hour sleep, then they should be having a nap by 9 a.m. So when the baby wakes up, feed them, feed them at 7, have whatever activity with them. By 9 o'clock, see how they look like, observe them. If they look like they're starting to get tired, put them down for a nap. It's the basic. It's so complicated. I can't tell you everything about like different ages. That's the problem. One video is not enough to say everything, but I'm telling you, this is a really good guide if you keep this in mind. This routine: feed, activity, sleep, feed, activity, sleep. That has been really helpful for me. And until now, looking after somebody else's baby and being able to use that and be successful in it, it helped me realize that it's actually really useful information, and that's why I wanted to share it with you. Seriously, and I love this baby so much. It gives me so much love. And I love it when my ex-husband comes here to pick him up and he doesn't want to go with him. It actually gives me some joy. Not in a spiteful way. Well, maybe a little bit. Maybe a little bit of spite. When their carpools over here, or like outside my place, he gets so super excited. And then when he sees me, he starts running towards me like he's so excited. Oh, I get so much joy from that. I hope you like this video. Give it a thumbs up if you like it. Share it with your friends and subscribe to my channel. I'm a ninja without a name. Don't fall in love.